Well, with the first presumptive case of coronavirus confirmed in southern Nevada, you may have some questions lingering about what action to potentially take. Joining me now on set is Dr. Joe Corcoran, Chief Medical Officer of HCA Healthcare. Thank you for being here, Doctor.
Happy to be here. Thanks, Brian.
Let's get right into it with those numbers being low in terms of fatality rates. You look at SARS, around 10%, MERS, Middle Eastern Respiratory Syndrome, up to 40%. These numbers, 3% and under, even lower outside of Wuhan, China. Is there some perspective we need on this to know that, for the most part, even without a vaccine, most people, the vast majority, survive this?
Right. And Brian, you know, the fatality rates are the highest in the communities where the healthcare is the least developed or the least available to the patients. So certainly in the Las Vegas Valley, we have very little to worry about. Most people who live in Las Vegas are very low risk. But, you know, certainly the healthier you are and the younger you are, the more likely it is that you're going to get through this without any problems, even if you are infected.
Why is it children are seemingly so much better equipped to handle this?
Well, as one of my friends once told me after I suffered a fracture, medicine is a tribute to the fragility of man and the elasticity of children.
Very solid point.
Kids bounce.
Talk a little bit about how it spread and what people can do. We keep hearing hand washing, but how specifically is it spread? Is it the droplets that are coughed out? What can we do to stop that?
So, you and I were talking before the camera came live, and this is flu season, right? So we really are just focused on the same precautions that we should be having every day during every flu season. Most experts agree that, you know, this is produced and shared by a cough. It's not something that floats in the air and stays around like some of the infectious diseases. So it's not something that lingers in the air for a long time. But when someone coughs, it gets on a surface like this chair. So the next guest comes up and puts their hand on the chair, and then they touch their face, they touch their mouth. That's when they're at risk.
Cleaning surfaces, cleaning hands, essential. The vaccine could potentially be up to 18 months away. Right. What can we do to raise our own immunity in addition to hand washing and wiping down surfaces? How do we make ourselves tougher, if you will, more resistant?
So one of the things that I preach to the amazing staff that are in our 3 hospitals here in Las Vegas, Sunrise, Mountain View, and Southern Hills, is we've got to take care of ourselves first. And that means eating, sleeping, all the things that your mom told you were good for you, right? So we've got to take care of ourselves and we've got to take care of each other if we're going to be able to take care of patients in the community. So really it is about living life the way that your mom told you to.
Mom had good advice. And again, this is the first presumptive case in southern Nevada. It is possible the test from this patient could still come back negative, correct?
It's possible, but not likely.
Okay. And also, more and more people are looking at their phones, seeing alerts of more people having coronavirus. That is also a part of having more people tested, correct?
Exactly right. Exactly right. And a lot of people aren't appreciating that. As we do more testing, we're going to find more disease. We know that the virus is in the community already. So that's why the fatality rate is so hard to calculate. How many of those people are not even going to be bothered by it? They're not going to go to the doctor, and they're sure as heck not going to end up in an emergency room.
The Chief Medical Officer of HCA Healthcare. It is great to have you here, Doctor. And again, it's good, I think, for our viewers to hear not to worry as much, to bring in a little bit of reality. We want to make sure that we're informing, not scaring you. And we love this factual reality that you brought in. So thank you, Doctor, for your time. This entire interview is going to be on 8newsnow.com, and we're going to be back in a couple minutes. Stay with us.